As we head into cold and flu season with COVID numbers rising, we are checking in with infectious disease Dr. Zain Chagla. Good morning, Dr. Chagla.
Hi, good morning, Annette.
Wow, I think it's been August was the last time that we talked, but the fact that you're here means things are getting bad again.
Yeah, I mean, we are seeing more COVID transmission. I think we saw this all over the world, especially with the rise in some of the new immune-evasive variants. The good news is many places in the world are starting to see their decline, and so hopefully we'll be seeing that here soon. But unfortunately, we are also seeing the rise in other viruses, and I think this is what's actually causing more of the impact on our system now. Influenza and RSV, which were, all but eliminated during COVID-19, that have come back with a vengeance and are really showing themselves in terms of being pressures on the healthcare system.
And are they coming back because we've been, we were in lockdown or we were isolated from each other and, we weren't getting sick for the most part if you kept healthy. And now are our bodies just not used to viruses again?
Yeah, I mean, we did a lot to disrupt seasonal transmission patterns, right? I don't think we've ever had years in history where we've been able to disrupt influenza season, yet we did it for 2 years, RSV similar for 2 years. But we have evidence from around the world in places where, things relaxed, where these viruses entered, whether they were from travel, more contacts, dropping masks, etc., that you see these large waves, often outpacing prior waves from years past. And unfortunately, we're experiencing that now. And again, this was unfortunately an eventuality. I think, obviously what we did in the last 2 years was still important for protecting the population for COVID. But I think we're learning that, it's very hard to disrupt these patterns long term. And unfortunately, these viruses will come back.
Mm-hmm. And RSV, this is a virus that strikes mainly younger children.
Mm-hmm. Yeah, young and old. So we see problems in children with immature respiratory systems, but we also see RSV in elderly individuals, those over 70 with underlying lung disease, where it can lead to even 10% of hospitalizations being fatal in that context. So it is an important virus. Thankfully, it sounds like there's a lot of progress in research on vaccines, and so hopefully by the next year we'll have something to offer individuals. But this is really causing problems, especially in our pediatric hospitals.
Mm-hmm. Which have now had to ask some adult or general hospitals for, can you make room for our ICU patients who are 14 and older? But like RSV, I've never heard of it until this season. Is it newly renamed or is?
Yeah, I think we all have a new respect for infectious diseases. Let's just say that. But RSV was around. It's been around for a while. All of us saw it. All of us saw it was an untreated need. Unfortunately, progress in vaccinations for RSV has been very slow over the last 30 years, and have a lot of failed vaccines along the way. And so, I think we're recognizing that this disease does carry a burden, and it carries a significant burden in our young. We have always known this. And it carries a significant burden in our old. And so hopefully, again, this renewed attention to respiratory viruses, to vaccination, really helps with further, respiratory infections, not just COVID-19.
Mm-hmm. And speaking of COVID-19, we've got about 30 seconds left. What about for people who are, another booster shot? Do I really need it? Yes, we really need it, right?
Yeah, absolutely. And I think, the people front of line should be the ones that are vulnerable. Everyone probably does benefit from this, but the ones in the front of line, those over 60 immunocompromised underlying health conditions, you should be getting it, in that 6-month window. When that 6-month window occurs, get your flu shot at the same time. You can take it at the same time, recognizing that we need to do what we can to keep people out of hospital this year.
Okay, Dr. Zain Chagla, thank you for joining us.
No problem. All the best.
Okay.